Resuming debate, the honourable member for Vancouver Kingsway.
Thank you, Mr. Speaker. I rise today to speak to Bill S-201, an act to prohibit and prevent genetic discrimination. I'm proud to indicate the NDP caucus full support of its goals and its principles. I want to take a moment to congratulate my honourable colleague from Don Valley West, who, as long as I've been in this House, has been a paragon of standing up for the principles of human rights and anti-discrimination in a number of areas, and I congratulate him on his stewardship of this bill. Originally introduced and passed in the Senate as a private member's bill, the latest version of S-201 proposes to make amendments to the Canada Labour Code and the Canadian Human Rights Act. It also introduces a series of new offences and penalties for genetic discrimination in contracts and the provision of goods and services. New Democrats strongly believe that the federal government must work to prevent genetic discrimination in order to ensure that Canadians can make use of genetic testing without fear to improve their healthcare planning and treatment options. New Democrats are proud to stand with healthcare providers, medical ethicists, community organizations, and the overwhelming majority of Canadians in support of genetic privacy and in opposition to discrimination based on genetic information. That's why New Democrat MPs introduced legislation similar to Bill S-201 on 3 previous occasions, including former MPs Libby Davies, Bill 6A, and Judy Wazaliza-Lease. Now, it's been said that New Democrats are Liberals in a hurry. In this case, it is certainly true that the NDP was ahead of the game. And frankly, if Parliament had followed the NDP lead in 2010, when this legislation was first introduced by NDP MPs, Canada would not be the only G7 country without this important protection today. By its very nature, our genetic information is deeply personal. Genes are the basic building blocks of heredity in all living organisms. They are made up of DNA, and DNA contains the instructions for building proteins which control the structure and function of all the cells that make up of our bodies. Privacy protection is therefore an essential element for maintaining public trust in the value of the rapidly proliferating field of genetic testing and treatment. Like many other significant innovations, the information made available through genetic testing offers both tremendous benefits and potential risks. On the one hand, genetic information can be used to diagnose genetic conditions and identify predispositions to genetic disease. This helps folks seek treatment early and adopt lifestyle habits to minimize the possible harm of a genetic condition. It also helps healthcare professionals tailor therapies to a patient's specific genetic profile. On the other hand, without appropriate legal restraint, genetic information can be misused to subject Canadians to discrimination based on the traits revealed by genetic testing. For example, if an insurance company learns that an applicant is at a higher risk for a certain disease, this may affect the cost and terms of the policy they're willing to offer, if they offer it at all. And if an employer knows that an applicant is at a higher risk of developing a genetic condition or illness, they may be unwilling to hire them or continue to employ them. Now, currently, there's no law in place that specifically protects Canadians' genetic privacy. Only a voluntary code of conduct governs how the results of genetic testing can be used by employers and insurance companies, and that's not good enough. Moreover, existing Canadian privacy and human rights legislation is wholly inadequate to address genetic discrimination because it fails to address cases of, quote, future disability, perceived disability, or imputed disability, end quote, and it fails to proactively prevent discrimination. Instead, it offers remedies after the discrimination has already occurred. The person who is discriminated against must make the complaint and then seek appropriate legal action, which is often a costly and time-consuming endeavour. This puts Canada out of step with our country's major industrial counterparts. As Richard Marceau, General Counsel and Senior Government Advisor at the Centre for Israel and Jewish Affairs, has pointed out, Canada's wait-and-see approach has resulted in a serious legislative gap that no longer exists in any of our G7 partners or in countries like Israel, which enacted comprehensive safeguards as far back as the year 2000. In liberal democratic societies, the 14 years that followed clearly indicated that legislative protections would not destroy the insurance industry, no more than they would cause employers to go bankrupt. Experience shows that these fears are unfounded." End quote. Now, Mr. Speaker, Canadians from coast to coast expect their government to take immediate action to close this gap and protect their genetic privacy, and none more so than those directly touched by genetic conditions and illnesses. I recently had the honour of participating in Ovarian Cancer Canada's Walk of Hope at Queen Elizabeth Park in Vancouver. Now, ovarian cancer is the most fatal women's cancer in Canada. Every year it claims approximately 1,800 lives, and nearly 2,800 Canadian women will be newly diagnosed with the disease every year. Because it's often caught in its late stages, 55% of women diagnosed with ovarian cancer will die within 5 years. And although existing research has confirmed a strong link between genetics and ovarian cancer, women may fear testing, and some don't get testing because their genetic privacy remains unprotected. According to Elizabeth Baugh, the CEO of Ovarian Cancer Canada, while all women are at risk for ovarian cancer, women with specific gene mutations are at greater risk than others. Knowing about your genetic makeup enables informed decisions about preventative action. To support this, we need assurance that genetic information won't be misused by employers or insurers. Now, this view has been echoed by Ovarian Cancer Canada's partners in the Canadian Coalition for Genetic Fairness, an alliance of organizations dedicated to establishing protections against genetic discrimination for all Canadians. These include the ALS Society, Alzheimer's Society, Canadian Breast Cancer Foundation, Canadian Congenital Heart Alliance, Canadian Cystic Fibrosis Foundation, the Canadian Organization for Rare Disorders, Huntington's Society of Canada, the Kidney Foundation of Canada, Multiple Sclerosis Society of Canada, Muscular Dystrophy Canada, and many others. Now, these groups advocate on behalf of the families directly affected by genetic conditions and illnesses, folks who are witnessing the disturbing prevalence of genetic discrimination firsthand. According to the Coalition, cases of genetic discrimination have been documented in Canada and are continuing to grow as more genetic information becomes available. To assume that someone's DNA will result in a disease or disorder is faulty, misleading, speculative, and dangerous. Every person has dozens of genetic mutations that could increase or decrease his or her chance of getting a disease such as diabetes, heart disease, cancer, Parkinson's, or Alzheimer's disease. Indeed, a groundbreaking study from the University of British Columbia documented precisely how widespread this discrimination has become. UBC researchers surveyed 233 Canadians with a family history of Huntington's, but no symptoms of the disease. They found that nearly 30% of subjects experienced unfair treatment at the hands of insurance companies. Mr. Speaker, it's clear by prohibiting genetic discrimination, Canadians will be empowered to make more informed choices about their own health without having to fear negative repercussions. New Democrats believe that no Canadian should ever have to forego critical testing because they lack protection from discrimination. That's why New Democrats strongly support the principle behind Bill S-201. If passed at second reading, we will work hard to engage in a rigorous study of this legislation at committee because it's vitally important that we get the details right. Countries that have enacted laws to prevent genetic discrimination have taken various approaches, and we should learn from each experience to craft a comprehensive made-in-Canada approach to genetic privacy. Mr. Speaker, all Canadians are affected by genetic discrimination, and leadership is needed at the federal level to ensure that genetic testing is only used to improve and save lives. I hope that the federal government will work with the provinces and territories because many employers and insurers in this country fall under provincial jurisdiction, and we want to see this legislation and approach replicated at all levels so that every Canadian, no matter if they work in a provincially or federally regulated workplace or regardless of where they seek insurance, are covered by this bill. I want to conclude just by saying there is one improvement to this bill that I'll identify right now. While it prevents discrimination, we need to make sure that insurance companies aren't able to offer incentives to people to get a lower premium on insurance if they voluntarily subscribe to genetic testing. So those are the kinds of positive proposals the NDP will bring to the table. I congratulate my friend and the government for bringing this important legislation to this House. Thank you, Mr. Speaker.